Hey, listen, thank you. I appreciate you coming. This is a wonderful opportunity to share. As I have suggested, it's the first sort of public meeting about our Blue Zones initiative. As I mentioned, we're going to be very privileged to have Margaret Brown, who is from the Blue Zones Corporation. She's going to come in by Zoom in a minute. But as a brief introduction, this is the fifth public meeting I've done, or open meeting, in about 8 months. It's taken a while, but at the end of the day, we just keep pushing along. The introduction, I would say, is the famous quote by Voltaire, who said, "We never live, but we're always expecting to live." And I think that's the great thing about the Blue Zone Community Initiative, that it really is about living. And I want to share, a couple of things that in our healthcare, our family was in the healthcare business for many years, but as I prepared for this and thought about it, there's some things that are by the numbers, okay, in the introduction. And the compelling thing for me was at the end, 5 months of last year, in 2024, I went to 5 funerals, then another one in January, and they were all my age, except for my one cousin who was a couple years older. And the second thing is when you really understand, as I have become to understand, how lousy our food system is and many different things like that. So the introduction that I keep making to the city of Hot Springs and other places, I said, what makes Blue Zone so wonderful, and Margaret's going to tell us all about this here in a minute, is it is a great non-medical model. So without stealing her thunder, I wanted to tell you what was compelling to me about why I think Blue Zones is a perfect match as a community initiative. We were fortunate that in our family for over 40 years to be in the healthcare business. It was very interesting. We had nursing homes, retirement community. We did several assisted living projects in several states, had a home health agency, institutional pharmacy, and about 30 years ago, they were so interested in trying to start a community hospital, which eventually took off. Not once, not one time in all of those industries do they ever really dwell on the healthy living model at all. So that's why I think it's a great honor. And can Margaret hear us, or she's...
I can hear you.
Oh, good, good. I know to be nice. So Blue Zones to me, as I have been around the healthcare universe, makes the most sense. It is the greatest thing that is a community participation, which I think has the greatest opportunity to be long lasting. So instead of me trying to do the best that I could in an introduction, Margaret, thank you for joining us. And I guess you can't see us, but you can hear us.
I can hear you. And can you just tell me how many we have participating
Yes,
today?
yes. We have about 15 or so, and some ladies we know. Some of them saw the ads, and they, fortunately, and obviously, they do know a little bit about Blue Zones. And as I said and shared, we know our greatest opportunity is to take the video, share it, and reach the masses. So.
Got it.
Okay.
I appreciate that. Thank you so much. I love that introduction, Dennis. You did a really great job on framing out kind of some of the things that differentiate Blue Zones from your typical healthcare, for example. And I would say right now, today, where we sit, we're facing kind of unprecedented shifts and the way that we are going to be looking at health and well-being into the future. So, last year this time, we were very reliant on things like public health, which, by the way, Blue Zones partners a lot with public health in all of the communities that we've done work. Well, if you're following the news, a lot of those positions are now eliminated because of the elimination of funding through HRSA or CDC. that really funded, flowed through the states to fund things like prevention programs that were aimed at reducing the incidence of diabetes, for example, or reducing the incidence of chronic heart disease, providing education on how people might survive a heart or a cardiac event. Those kinds of things are now going to be harder and harder to come by. In addition to that, the current landscape and news this week is the pending federal cuts to Medicaid that are going to impact eligibility rules and impact the kind of state matches for expanded Medicaid, and possibly the subsidies that would be supporting things like the private or the healthcare access points, insurance that are subsidized by the federal government. And so when you are facing those kinds of headwinds, it becomes even more important to think about, how do we create environments where people can thrive, all people, no matter what their age is, no matter what their economic status is. How do you create environments where you create communities where by just living there, you have a healthier, longer life expectancy? So with that, I want to dive in and share a presentation, a quick little flyby of what Blue Zones is and how we work. Sound good?
Yes, yes.
So for all of those in the room, the purpose of Blue Zones and what has been our guiding star from the beginning is to empower everyone everywhere to live better, longer. It's really important to have that emphasis. We can help people have improved health, but we also want them to have a purpose and a reason to live longer. We want them to be excited about being healthier well into their 80s and 90s without the burden of disease. And it's important that we're thinking about how communities and everyone within a community can experience that benefit. And so that really is the purpose of Blue Zones. We come to this work based on the research and background of our founder, Dan Buettner Sr., who was really on the lookout around the world for places in the world where people are living the longest, healthiest life, vibrant lives, active until their 90s and 100s. And these are the 5 places in the world that they located, places in the world where it is not uncommon to see people in their late 90s swinging an axe, fishing, providing for their family, volunteering in the community, driving still. In the US, that's very uncommon. The other factor that really was driving this research from National Geographic and Dan Buettner was this concept that was really established by the Danish twin studies and what we have come to know as the zip code effect, which is our environments, the places where we live, are contributing about 80% of our health outcomes, our expected life, our life expectancy overall. And so when we think about that, if you look at the full environment includes things like your built environment, your food access, your healthcare access. 80% of that is contributing to health and longevity, and only 20% roughly is something like genetic makeup, things that are maybe unavoidable. So when Dan and team went back into these communities, the natural place that they were looking at is the environmental effects. What's going on in these 5 communities? What is in the environment that's contributing to extra long health? And they found things like these communities naturally moved more because their built environments enabled them to do so. So when we look at the design of cities and towns, we're often looking at can residents move naturally? Can they get from their homes to businesses, to schools, to work by walking or biking? What does public transportation look like? Surprisingly to some, maybe not to you all in the room, when you have great public transportation, you move more. You actually walk more, you move more, you expend more energy than we do walking to our car and getting in our car and driving. Also, these original Blue Zones communities had this really great ability to have the right outlook. Their communities were infused with faith-based organizations and cultures. but also not just our traditional faith base. They really had strong sense of purpose, of taking care of family, from cultural values, etc. And also cultural nudges around downshifting, which can also be an environmental factor as well. So in these original Blue Zones, it was very common for people to take a moment out of the day to take a nap, for example. Take a moment out of the day to do some meditation, maybe start their day with prayer, maybe spend some time with family in a very dedicated way every afternoon. Maybe it's going on a fishing, quick little fish trip at the end of the day, or maybe it's gardening when you get home from work. Those were infused as part of everyday life in these original Blue Zones. Eat wisely. It is no secret. Everyone knows the power of food. Dennis, you talked about it in your opening. The food is the bedrock of health and well-being. In the original Blue Zones, they did tend to be plant-based societies. However, that doesn't mean that Blue Zones is out here promoting veganism and vegetarianism in an overt way. What we are saying is, can we increase healthy food options in communities everywhere that people go in their daily life? And that's an important component. We also think about the 80% rule, which is an environmental construct, part cultural. And there is a concept of wine at 5. In many communities, we call this friends at 5, because there's many communities that are struggling under a burden of abuse of substances, including alcohol. But where there's a healthy relationship, we do like to bring people together, like-minded individuals, community, residents to come together, meet one another, be social, explore what's going on in the community, share, great conversation, great food, and make friends. And finally, this ability to connect. All of the original Blue Zones regularly connected. They had a strong sense of belonging to their community, immense community pride, wanted to give back, but also felt like the community would have their back, in times of need. When you have natural disaster or you have unexpected events happen, the community shows up for them. This concept of loved ones first, really focusing in on time spent with family, and keeping those at the forefront of our minds and being able to give back. And then right tribe, really getting at those closest relationships that we have with our best friends, the maybe 1 to 3 people that we would go to on a good day or contact on a bad day. Surprisingly, here in the United States, over the last 20 years, we have gone from reporting about 6 best friends in our life that we saw and connected with on a regular basis, down to about 1.5 today. And that's coming straight from data and research. And typically that is someone that's found on our phone, on social media, that we don't even see face to face. And so that erosion of personal close friendships is really causing a lot of strife in terms of loneliness and isolation, follow-on mental health impacts, etc. So with Blue Zones, when we're talking about bringing Blue Zones to a community, we're really focused on the places where people spend the most of their time. This concept of a life radius, where you go about in your community, where the majority of the community spends their time. The places, work sites, schools, restaurants, grocery stores, faith-based organizations, powerful partners in this work, but also in their own organizations within their own 4 walls. People, how do we engage people? How do we break down social isolation? By bringing people out and engaging them in purposeful ways, by developing moais and essentially borrowed from our Okinawan culture, bringing people together to do things together, such as walking, reading, eating, and intentional ways to build out social networks in person, not on Facebook. That may have been the construct of Facebook, but it's not where it's gone. And so how do we bring that back to in-person touches? Facilitating things like purpose workshops, helping people explore what their purpose is and helping them to articulate that in powerful ways that they can give back in their personal life, to focusing on purpose, but also maybe bringing that purpose to their communities with volunteering and other things. And then finally, policy, kind of the bedrock of changing environment is embedded in policy. So we take a strong look at the built environment. Is the built environment conducive to getting people out and moving? What does park space look like? How are parks connected to where people live? How are schools connected to where people live? Are school environments optimized in the built environment to get kids moving more, to serve as a community hub, What does housing look like? What does the food environment? How is food showing up, especially local, sustainably grown food, or healthy food, period, everywhere that people are touching it, whether it be in a food bank or if it be on a market shelf or being in a corner store. Then we also approach tobacco and alcohol policy as well. And so I always like to share this slide because when Blue Zones got this start, we were pretty heavily focused on healthy people, creating healthy individuals. But the follow-on effect has actually trickled over to healthy environment. Many of our practices lends itself quite well to creating healthy environments, healthy economies. It turns out when you have an environment where people want to live and where people want to be, you also generate a healthy economy where people are giving investment, showing up in their communities, and people want to stay there. They want to grow families there, and that's where they begin putting their attention and time. So with this, it also represents the kind of partners it takes to support a Blue Zones project. You want your healthcare entities, you want your health plans, you want the public health sectors, especially today in light of some of those market forces that I talked about. With funding eroding public health infrastructure, there needs to be these kinds of partnerships where we can keep that infrastructure in place and keep a focus on healthy people. Healthy environment. Turns out when you have more people walking, biking, or being in green space and less reliant on getting in a car to get around everywhere, you reduce emissions, create healthy environments. When you optimize green space, focus on developing more green space, you actually help also in positive ways there. And when you look at things like sustainable farming and gardening practices, you also regenerate the earth, which is also a follow-on effect. Healthy economy, those partners include chambers of commerce. You want your business partners. You want anyone that's responsible for developing the economy, so your economic development partners, the healthy environment, your private sector partners that have social responsibilities because their corporate entities are very important in that healthy environment. So this is a really important framework for thinking about who should be involved in this work. Blue Zones has been hard at work. We've been doing this for quite over 13 years, and we have touched over 90 communities with what we would call a full certified project, probably another 13 when we're working in the worksite space of optimizing individual work sites to be focused on health and well-being. And what's not represented here is probably more than 200 communities where we've brought light touch support around policy development, optimizing things like building out trails, building out safe routes to school, building out food infrastructure and planning that we also are continuously focused on. Here, what we have in addition to that is some outcomes. These are from the communities where we have spent probably our greatest amount of time. 16 years in Albert Lea is our first community. Amazing things that have happened there. Now, today, 16 years later, Albert Lea, a community that once people were moving away from, very quickly have become one of the top 50 small communities in the U.S. to move to, despite being in Minnesota with the harsh winters that they have. Beach cities, we have initial in the first 5 years, a 55% reduction in childhood obesity.
Yeah.
Today, if you go to the Beach Cities Health District website that has continued with Blue Zones work in their communities, they're announcing a 73% reduction overall in childhood obesity. And you can see these other stats for themselves, but this work does beget lifelong impacts. And we've continued to be recognized in the United States for being a partner to help address these things on the national level. And this is basically the magic to what we do. We're focused on creating and changing this kind of continuum, creating an environment of health and well-being. Today, that red dot, that 1% plus chronic disease focused disease burden portion of our community is where we spend all of our dollars. Our work sites spend all of their money there. Our communities, whether it be on the county level, the city level, or in our health plans through our work sites, spend all of our money on treating that population. But right behind that is a wave of pre-disease individuals that are obese or overweight, have already experiencing taking one or more medications to manage things like cholesterol, Maybe they're managing things like diabetes and getting on top of that, also expensive, but are going to continue to grow in that and become that disease burden population. And then what you have is a very small group that are the healthy group that have no or low risk. And what we hope to do and have proven to do is to change this trajectory in communities where we create more healthy, sustainably healthy behaviors, population, reduce the out risk, and then ultimately reduce that disease burdened population. And so this is a very different model that begets long-lasting compounding impacts. And for those of you in the room that might be just a resident, I want you to know that we report this and value that those partners that I highlighted earlier can actually grasp. But this also has great lifelong impacts for community members. We have a very long list of community members that are talking about the life-changing impact that Blue Zones had on them, whether it was from losing weight, coming off of medications, more emphasis and focus on their purpose and overcoming, kind of burnout in their life and wanting to get back to what has meaning for them. It starts with creating value for those partners that want to invest and be a part of this, and then you begin to see those stories on the community level and the organizational level, the employees that are experiencing this, making lifelong change, not to mention things like growing children from the very beginning that are going to have a lifelong impact and never realize the burden of disease in their life because they will be healthier from the very start. And so with that, that was a very quick flyby. I want to take questions. I'm here to answer your questions. I'm here to learn about your community. And so I'm going to stop sharing and go back to my video. And Dennis, I'll turn it back to you in the room.
Okay. Hey, I think this comes right off of your website. And Mark, you do such a good job. I've done this a couple of times where you can't see anybody but your screen. So thank you so much. But it's a simple way that it gets the whole process. You keep talking about environment, talk about different things, but I read this off of your website. People in Blue Zones don't have better discipline than us. They're not better self-control. They don't have better programs. They live in environments where healthy choices are the easier choice, says Dan. So as I've shared with other people and your program, your proof, all these communities where this happens, and in particularly, I've been to Loma Linda, California several times, have some friends out there, and it was funny, the very first time I picked up the book, I guess it was maybe, 5 or 10 years ago, whatever. And it's like, oh, Loma Linda, that certainly makes sense, but that is a great one to resonate. The other one that I had been to as well is in Brevard, outside of Asheville. So I just wanted to say that as we see the slides, we hear the presentation, it's complicated, but yet it's not complicated. And the greatest thing, again, I said in the introduction, it's a community-based program. So when we all are working together, that's how I think it works so well. But is there some specific questions? I know that's a tremendous amount of information, and thank you for making it so complete. We've got a couple of video things going on right now to record this, but is there something particular that you'd like to ask or find out about? Other than the key point we get back to, how do we get started? But
I'm curious if you're having any success with the Hot Springs community, like maybe the Chamber of Commerce or Hot Springs Village, like where I live. Do you have any interactions with those entities moving in the direction of becoming more involved?
I tell you, through the contact with Deb, and I'm not sure where y'all are, Hot Springs Village, Margaret, is again a larger community, a larger part of our county. They've been a hard one to get into, and I understand they had a change of administrators. presentation at Chamber of Commerce, at the City Council. It is a new concept, and so people's response is, well, where's everybody else on this? So it's a little bit of the chicken and the egg, and it's a meeting like this. It's more conversations. It's what we're going to do in June at the Lavender Festival. But I think that overall, there has never been a negative response about it, or that doesn't make sense. I mean, and in particular, I know I think you mentioned earlier, and if you folks at home, if you haven't seen the Netflix documentary on it called Living to 100, so well done, just a wonderful explanation about that. But on top of all of their, I wanted to say two other things. On top of all of the success and numbers and studies and confirmation, I thought the most interesting thing, again, on the Netflix documentary of healthy food chefs, whatever, but Alice Walters out of California is the original person who started Farm to Table. And that story was just fascinating because food is everything, I've come to understand. But then clearly, the second thing for us here is, and I've said this to the city council, it's a natural. It's how this whole city community, and if you really want to go back 530 years when DeSoto came through here looking for the Fountain of Youth. I mean, it's just, we were born for this.
Yeah. If I may add to that question, I think, part of getting started is assembling a small group. I mean, Dennis has been kind of out here on his own, touting this, trying to get attention. And really, I would say, Dennis, if I may say on your behalf, what you need is kind of a little committee of folks that can help build the strategy, get in front of important leaders, make the case for, at least in the very least, getting a group of leaders, whether that be from your city council or from some of your other organizations, to just get on a call and let me walk through this very presentation with some other slides for context for them on this. Because as long as it's kind of like one person doing it, it's hard for them to take it seriously. But if you were to build a small group, a small committee that have maybe additional relationships than that you may have, Dennis, come from a different point of view on this, you may help get a small group that agrees to have a meeting to just hear the information and start there. Because you have to build the support, but you also have to have an ask. Can you just, sit down and listen to it? Can you meet with someone as a group and have this presentation? And so I would say, backing up from you just a little bit, is how do you form that group that can help build the strategy to help get to those other folks? Got it.
And that is, again, where we start, as I shared again, after we had the city council meeting, we finally get a little exposure there in this meeting, and it is all about building the group, the planning group, with as many and as quickly as we can. And I've joked about this a couple of times. I said, look, I don't want to feel like Noah anymore. You're like, So yes, that's again what this meeting can do in the video. We need so many people, and my request is between now and June 13, when we have the Lavender Festival, as a way to begin to pull that together, and then visually and with a truly staged presentation there, we're downtown Hot Springs for the 13th and the 14th, then I hope we really can launch out after that. But it is, Margaret, you've been so supportive and helpful, and yes, I no longer can carry this alone, so nor do I want to. So
it's been a lot of work on Dennis's
part. I tell you. But let me just say one more thing about your presentation. I mean, what you mentioned, and I understand this more so, again, community being together, but the Harvard book that came out, A Good Life, their 80-some year longitudinal study, and it is about social relationships. It is about being together, and that is clearly one of the obvious building blocks in what happens in the Blue Zone community. And if we were to pick something, I think that we could, again, begin to do more of, that would be a great way to, again, go to the village, have some opportunity to meet with many groups. However that unfolds, we'd like to do that. And then Margaret has offered, and I have asked a couple of times for the city managers, she'd love to do the presentation in front of them, and they're still like, okay, well, are people that interested or not? Or, it's just, we live in a great town, but the magic of being in the national park and 2 million visitors that come to town, whether you do anything or not, sometimes is not motivating to do something innovative, if that makes sense.
Well, I will say, I just got through doing an assessment in Sevier County, Tennessee. I think they're just narrowly beating you out with the Smoky Mountains National Park there in Gatlinburg, and
Yeah.
that it took a minute to get them on board, but I just met with the county mayor for Sevier County yesterday, and he was very happy that they went down this process. There were just things that they had never considered that were impacting the life of residents. Like, it's one thing to have an industry focused on tourism, but you also have got to take your county resources, your city resources, and say, how are we improving the life of our residents? The people that are basically the generators that are keeping the lights on, making sure that the restaurants are open, they're making sure, that hotels are clean and ready and available, and all the other things that come along with having 2 million visitors. But before we go, I know we only have a few minutes, Dennis. Are there any other questions in the audience?
Anybody else?
How are we been received from the city council and the Rotary Club, Chamber of Commerce, and all that?
Let me tell you, Rotary, because, again, some of those individuals had personal experiences about having health issues and being on that, what I call the path, very well received. National, in fact, I can send you a link on that. I've heard, I have been going to the city council for about 5 months, and there's always, a variety of things, but I will expand this beyond just them, as I say, going to the village and to our county, and there's many other groups as well. So we just, I told him, I said, I hope the first domino would fall rather quickly, but anyway, we're, again, from our southern expression, I know we're fishing in the right pond. We'll get it done, and Blue Zones is just, it's the perfect way to go. I just I can't say enough about
We're the perfect place.
Huh?
I said, we are the perfect place.
We are.
Perfect place.
Yeah.
It's great here,
Yeah.
We have the green space, we have the
Yes.
thermal waters, we have everything you could want to really encourage this.
Absolutely, absolutely. It's meant to be, and we just, we keep on persistence. But Margaret, thank you so much. We will hope that between now and June 14, we can get the city to have the opportunity with you, and we now have a lot more soldiers in the Army.
I love it. So great to spend time with you guys, and I hope I get to see you all in person, or at least your faces soon.
Yes, very soon.
Thank you so much. Have a great afternoon.
Okay, thank you.
Bye-bye.
It's so informative. If you're interested, send me your email and I can send you some of that slide deck. But let me be very clear. They are extremely well documented, and the beginning point of truly starting a Blue Zone certification community. And I would say, to just for a second to draw a comparison, they said, oh, they've done projects in about 200 cities and they've consulted. They have, but my initial recommendation, day one, to the folks and continue to be, is engage in the process. I'm sorry, just got to sit down. Engage in the certification process, which will take probably about 2 years. It would require maybe $200,000 to $300,000 because there is staff, there's training. The greatest thing that I believe in all of that is their requirement that they want you to go to at least half of the schools in Garland County and then teach and do quite a bit of education on food to them. Then it's going to the top 20 employers. I have already been to the third component. I have been to 2 of the 3 grocery store chains. They want to see changes in the grocery store, more healthy options. There's no reason to go to the big guy. I don't think they would do much, but anyway. And then the other component, so food, grocery stores, restaurants, workforce, going to the schools, and then all of the civic groups. And they want you, like, for example, Jacksonville, Florida, after about 2.5 years, they started, I think, earlier than COVID hit, and then they, restarted. But and following them on social media, they went to like 480 churches to then reach out to people, to have connection points. And time out for 1 second, because I'll tell one interesting story about this socialization and how it's different. I was very, very happy to finally, after 15 years, do sort of my bucket list thing. And have you ever heard of the Camino, or the Way of St. James, which is the oldest Christian pilgrimage in the world? They've been doing it for 1,000 years. So they walk all through Europe and different places, and you end up in Santiago, Spain, where they believe the remains of St. James is there. Anyway, it's something I wanted to do, and I would talk to my friends. It's like, hey, why don't you come with me and we'll go walk 500 miles? And they're like, no. So finally it's like, okay, I'm going by myself. Okay. The point of the story is there was one Saturday evening. I arrived at, I believe the city was Lawn. And it was a bit of about the end of the season, October, in the late afternoon. I come to the courtyard. I've been hiking all day. I'm hungry. I'm ready for the restaurants. There's 200 people sitting there at all these tables, and I think, well, maybe and I don't speak Spanish or whatever it was, but they're just visiting. And I kept thinking, okay, well, where do you order the food? And they would have some drinks, and there we go. And so this was pre-Blue Zone. So after a while, it's just like, all these people are just sitting here visiting. And then it's like, hey, this is pretty cool. I mean, hundreds of them. And they were not waiting to order dinner. And so if you've seen the documentary as well as in the book, I think it was the one in Italy that referenced some time ago, the whole city would shut down at 5 o'clock, or the most of it, and people would gather, visit, have a couple of glasses of wine, and then go home. And so the socialization is a challenge, but yet the creativity, the idea is how we can get together. And yes, small groups. And again, I wanted to mention how we really got started. The very, very beginning point was last summer, and we did Blue Zones. I called it the cooking experience, because in the book, it's a wonderful cookbook, and they said, hey, you need to gather with people. So the first event we had, I didn't even know half the people. Debbie came out from the village, and you came to the second one, I think. And I said, look, we're cooking together. I said, I'm not cooking for 12 people. I can't cook for 12 people. So we all cut up the onions. We did this thing. They loved it, just loved it. When are we going to have the next one? Because it was that interaction. It's not like, you did all the work for Thanksgiving dinner and they come, they eat, and they leave. It is, again, those two stories are, I think the backbone of how Blue Zones is, and again, the third element or third story related, going to Loma Linda, again, the church related, it's a big community built around the medical center and different things, but you just can't. Listen, I can drone on, but I'll tell you one thing that fascinates me. During the time of William Shakespeare and the writing, the average person's vocabulary was 30,000 words. Today, it's half that. We're about 15,000. And I can't find, I'm sure you can Google it again, but whatever that is that sometimes I say, I think we really have lost the art of conversation. And you obviously can go to any restaurant and sit down and watch 50% of the people, if not more, on the phones doing stuff like that. So, that said, I hope you've enjoyed it. I hope that you would then, when we get the video up, I got your names, but then we'll post it up. If you follow us on Arkansas Lavender Festival, because that was the best platform that I had to get the word out. And again, back to the one of the purposes here. What do other people say? Once, A, they didn't know about it. B, it's like, okay, well, that makes sense. And then it's like, well, what does everybody else think? I mean, nobody's like, it's like, hey, this is not complicated, but they do. I don't think there's a better model, because it is, again, the two things. It's community based. And I've said in a couple of times, it's like, look, even though one of the original Blue Zones is in Okinawa, Japan, it's like, I don't care what they're doing in Japan. I mean, we're only worried about Hot Springs and Hot Springs Village, and that's what we want to do. And so my favorite expression, at the end of the day, we do need an opportunity wherever, the next group we can meet with at the village. Would love to do that. And I think what happens with this video that gives a nice overview, then people who don't really know the whole story of Blue Zones, it's like, hey, spend 20 minutes, watch the video, you'll get it, you'll see what we're talking about here, and then hopefully that would quickly open a few more doors. So, any other questions, thoughts, ideas, as I used to say at work, or comments or threats?
I'm Melanie, so I'll just take off. I sell Medicare supplements and Medicare Advantage plans. My people that I work with are typically over 65. I live in the village. I made a conscious choice to be there to improve the quality of mine and my husband's life, and it most definitely has. I think it's a fabulous community.
Yeah.
And I can see where this could really thrive there. I really do.
Yes.
And I would love to see it thrive in the community that I work with, because it kills me to see people sick, and
Yeah.
to see people dependent on lots of medicine and all of the things that goes with that. So, I think that we're right, for some new ideas. I think we're seeing it in a variety of places, and I think this could be very effective. I'm willing to help you if I can. I mean, I'm a member of the chamber out there, and I'm a member of the chamber here, and
Good.
and I see the value all around. But I think that if you get out into the village, especially, and you get to talking to people, you're going to find a lot of people making very intentional choices, whether they know they're blue zoning their life or not. They
Yes.
are.
Yeah. And I have heard that consistently through a variety of, conversations and talking, that all that Hot Springs offers within its community, I think is maybe 50% more in the village, because of the way that it's, I don't know, the mindset, the way that it is. But let me say this again, or let me say this clearly. There are many things we can do and start before you officially would be enrolled in the certification program. Now, Margaret sent me the checklist. I mean, they take it, and I said it's somewhat of a franchise, for lack of a better word. I mean, you got to do A, B, and C, which is great. But at the end of the day, that's why I referenced Blue Zone cooking events. We'd love to have several of them at the village, having social interaction, and then the opportunity to share that we really can begin this now. That's why my opening quote was, we're always planning to live, but never really living. And so we can do this. And then I promise you, the last thing I'll say, at the first Blue Zone dinner, a couple here, and I think TJ was only like 72. And then she came, first one was in August, the next one we did in September. We did a third one, and then, which she didn't attend, she had cancer, and then she died in January at like 72. And it's just like, you really, I mean, we all have those stories and examples, but it's true. And you can appreciate, I think, what it would do to just have the conversation, to begin saying this is a focus and an intention of many people here, will help bring others along, as well as just the energy, the space, the conversation, all of that will move us in in a better direction, if that makes sense. Listen, thank you so much. My leg is killing me. We will put the video up, and I really appreciate your time and effort. Time and attention. And any questions, again, you can turn it off. Yeah.